Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Norma Frontalis, and here at the side you can see the diagrammatic representation of Norma Frontalis showing different parts of Norma Frontalis for the reference. So let's start our topic with introduction. Norma Frontalis refers to the anterior view of human skull. It displays the bone that make up the face and the anterior portion of cranium. This view is especially useful for evaluating facial symmetry, bone alignment, orbital shape, and dental structure. It is frequently used in anatomy education, radiology, forensic facial reconstruction, and plastic or craniofacial surgery planning. Talking about what are the bones visible from the norma frontalis, from this perspective, both cranial and facial bones are visible. They include cranial bones, that are frontal bone that forms the forehead, upper boundaries of orbit, and part of anterior cranial fossa. They include portion of temporal bone, that is lateral edges may be slightly visible near the zygomatic arches. Other bones that are visible are facial bone that include nasal bone that form the bridge of nose. Second is zygomatic bone that create the cheekbone and lateral walls of orbit. Third is maxilla that is from the upper jaw, part of nasal aperture, and the medial or inferior wall of orbit. And the fourth is mandible that forms the lower jaw and include the mental protuberance. Fifth is lacrimal bone that is present near the inner corners of the orbit. Sixth is inferior nasal conchae and vomer that is sometimes visible through the nasal aperture. Now let's talk about prominent landmarks of norma frontalis. They include orbital cavities that are rounded or quadrangular openings housing the eye. It is bounded superiorly by the frontal bone, laterally by the zygomatic bone, inferiorly by the maxilla, and medially by lacrimal and ethmoid bone. Second prominent landmark is nasal aperture. That is a pear-shaped opening leading into the nasal cavity. It is bordered superiorly by nasal bone and laterally and inferiorly by the maxilla. Further in prominent landmark we have anterior nasal spine, that is a small bony projection at the inferior margin of the nasal aperture that is formed by the maxilla. Next is mental protuberance and tubercle that form the chin and can vary widely in prominence. It gives the lower face much of its shape. Next landmark is supraorbital margin and foramen or notch, that is the ridge that runs along the upper rim of orbit. It transmits the supraorbital nerve and vessel to the forehead, as you can see here in the diagram. Next is infraorbital foramen. You can see this also in the diagram. It is present below each orbit on the interior surface of maxilla. It transmits the infraorbital nerve and artery. Now let's talk about structure and articulation, sutures and articulation that are visible from norma frontalis. They include frontonasal suture that is present between the frontal and nasal bone. Internasal suture that is present between the two nasal bone. Zygomaticomaxillary suture that is present between the zygomatic bone and maxilla. Intermaxillary suture that is fusion line between the paired maxilla, and mental symphysis that is midline fusion site of the mandible. In infants it's a suture, in adult it fuses into a ridge. Now let's talk about clinical significance of norma frontalis. First is anthropometry and forensic, as it used to assess facial proportion and reconstruct facial features from skeletal remains. Second is craniofacial anomalies, as it helps identify conditions like hypertelorism, cleft palate, mandibular asymmetry, or post-traumatic deformities. Third is radiological assessment, as in X-ray, especially waters and corridor views. These angles reveal sinus health, orbital fracture, and mid-facial trauma. Fourth is plastic and reconstructive surgery, as is used in preoperative planning for rhinoplasty, orthognathic surgery, and aesthetic assessment. Now let's talk about conclusion of this lecture video. Norma frontalis present the most human and recognizable view of skull, where form, function, and facial identity converge. It serves as a vital frame of reference in both health sciences and art, offering insight into structural integrity, clinical conditions, and anatomical complexity of the human face. So this was all about norma frontalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.